Benign prostatic hyperplasia or hypertrophy is a very common condition in our community. Approximately 20% of men end up undergoing surgery for this condition in their lifetime. This frequency increases with age. Patients usually present with either obstructive or irritative symptoms. The obstructive symptoms are hesitancy, poor flow, straining to void, and the feeling incomplete emptying. The irritative symptoms are frequency, going very often, urgency, rushing to go to pass urine, and nocturia, getting up at night. Some patients may also present with recurrent urinary tract infections, recurrent hematuria, blood in the urine, or even urea retention, the bladder blocking off. We generally assess the severity of these symptoms by using a symptom score. This is an American Urological Symptom Score or International Prostate Symptom Score. There are 7 questions that we ask patients, and these are scored between 0 and 5. And they're really divided into those obstructive and irritative symptoms. And we get a score out of 35 that the patient fills out independent of the doctor, so that we get an objective assessment of the severity of these symptoms and how they're impacting on this particular patient's life. You can divide them between 0 and 7, 7 to 18, and 18 to 35, with 18 to 35 being severely symptomatic, 7 to 18 being moderately symptomatic, and 0 to 7 being mild. We then investigate patients by doing a number of tests. We would usually do some blood tests to check for kidney function. We would do a PSA to check for prostate cancer. And we do a flow test to assess how fast urine is coming out. To do a flow test, the patient passes urine into a toilet and we measure the amount the patient passes and the speed, and then we can compare that to the normal population and see if there's obstruction or not. In some patients, we do a urodynamic evaluation, which is a pressure test on the bladder. That involves putting a catheter in the bladder, filling the bladder with fluid, getting the patient to pass urine. We measure the pressure the bladder squeezes out, how fast urine comes out, and from that we can tell if there's a significant blockage from the prostate. We also can tell with that test if there's instability, that is the bladder contracting by itself. A very important part of the assessment is also the clinical examination, where we feel the prostate, we feel the size, and we most importantly check for any nodules or thickening which may indicate prostate cancer. Generally, we also do an ultrasound to check what the residual volume is. This is very important because there's a large amount of urine left behind that can be a sign of the bladder failing, and it can be a sign that we may need to do some treatment to prevent further damage or problems occurring. One of the other tests that we would also do is a urine test to check for any infections. If the condition is left, patients can develop chronic retention with the bladder blocking off and not functioning, and occasionally patients can develop renal failure with blockage up to the kidneys. So once we've done all these tests, we get an assessment of the severity of the symptoms, and our management is then based on the severity of the symptoms.